This week we're focusing on the very interesting topic of psychopathy. So what is a psychopath? A psychopath is a person who has distinct behavioral patterns that differs from the general population in regards to our level of sensitivity, empathy, compassion, and guilt. They're really your hardcore criminals. A primary psychopath is what we can also call a criminal psychopath, and they demonstrate the physiological and behavioral features that represent psychopathy. A secondary psychopath, these are the ones that many books and movies are written about. And these are the folks that have psychopathic traits, but they also have a very deranged sense of who they are, severe emotional problems, have a lot of inner conflicts. The third type is a dissocial psychopath, which is more of a product of their environment, sometimes referred to as sociopaths. These type of psychopaths learn from the people around them, and they do not possess the physiological traits that the primary psychopaths have. And then there's antisocial personality disorder, which is the only diagnosable condition in a medical sense, and that's characterized by a lack of disregard for the rights of other people. Most psychopaths meet the criteria for antisocial personality disorder, but not all people with antisocial personality disorder rise to the level of psychopathy. In 1941, a psychiatrist by the name of Hervey Cleckley very much brought the study of psychopathy into the modern age by writing a book called The Mask of Sanity, which identified several traits that could help identify psychopaths. This influenced the work of Robert Hare, a professor out of Canada, who wrote a few famous books on psychopathy, including Without Conscience, that looked at the criminal psychopath, and Snakes and Suits, which looked at psychopaths who infiltrate the workforce. He's also the author of the Psychopathy Checklist, which is currently in a revised edition and is kind of the gold standard of diagnosing psychopathy. The Psychopathy Checklist rates 20 traits that are found in the psychopath. A score of 0 on one of these areas means that they don't have the trait. 1 means that they have some of this trait, and 2 means they definitely have a pattern of this trait. And the traits are glib and superficial charm. Think of the snake oil salesman, your very charismatic people that are good at schmoozing and getting people to believe that they're really a good person, and they're only doing that to take advantage of the person. A grandiose sense of self-worth, thinking they're better, smarter, more capable than other people. They're prone to boredom, and they have a need for stimulation. Pathological lying, lying for the sake of lying. Conning, manipulation. Having a low sense of remorse or guilt for when they do antisocial things. Shallow affect. Callousness and a lack of empathy. They have a hard time reading the emotions on other people, although there is some evidence that shows that some psychopaths are really good at reading other people. They just don't care what the other people are feeling. Parasitic lifestyle, they'll latch on to people, and they oftentimes get these people to think that they're really a good person, going back to that superficial charm type of thing. But then once they're no longer needing that person to gain something, then they'll leave the person in the dust. And they have poor behavioral controls, oftentimes impulsive. Promiscuous sexual behavior, early behavioral problems going back to before the age of 13. Lack of realistic and long-term goals. A lot of psychopaths will talk about having goals, but when really looking at them, we find that they're not actually making any steps towards those goals, and they're just kind of blowing smoke. Impulsivity, irresponsibility, failure to accept responsibility for their own actions. Several psychopaths have many short-term marital relationships. Juvenile delinquency records, so that differs from the early behavioral problems because that's more adolescence and actual juvenile delinquency, breaking in the laws. revocation of conditional release, breaking their parole, and criminal versatility, meaning they might be good at robbery this week, next week they're good at embezzling, the week after they're assaulting people. All right, moving on, just some statistics related to psychopathy. About 1% of the general population has a psychopathic personality, whereas up to 25% of the prison population has the disorder. About 1 in 30,000 psychopaths are serial killers, so that shows us that not all psychopaths are murderers and serial killers. The average IQ of a psychopath is higher than the average IQ of the general population. It doesn't mean that all psychopaths are brilliant. That's not the case. Probably the duller psychopaths are more easily caught, where the higher IQ psychopaths oftentimes are, have fairly successful careers, depending on what a person's definition of success is, because the people they throw under the bus is usually numerous. Comorbidity with mental illness is not all that common. But suicide among psychopaths is more common. If somebody's facing a very long prison term, a psychopath could very easily take their life. Most individuals, again, with antisocial personality don't have psychopathy. Most psychopaths actually don't engage in serious antisocial behavior. Recidivism rates for psychopathy is very high, especially people that score real high on the psychopathy checklist. Approximately 65% of psychopaths will engage in a crime once out of prison. Psychopathy is largely a male-dominated disorder. Nevertheless, there are female psychopaths, and it is a major problem in society, so don't ever minimize the female psychopath. People who are the primary or criminal psychopaths, they tend to engage in consistent and serious antisocial acts. They usually have excessively successful criminal versatility, again meaning that they can commit this set of crimes, property, robbery types of crimes, and then assaults and whatever else in the future. Violence tends to be more sadistic and severe. Sex offenses are usually more violently brutal, and oftentimes sexual gratification isn't the aim, it's the power and dominance that is more of the reason for these offenses. Psychopaths are also more likely to kill during the course of a non-violent crime. So if somebody's breaking and entering, a psychopath is more likely to kill to make that situation successful. The neurobiology of psychopathy is a very complex subject. We're just starting to really understand the biological correlation to psychopathy. So I just want to point out a few of the highlights. There is definitely a genetic link in psychopathy. It's not as strong as one would think, but it's there. Right hemisphere impairment in the brain is linked to an inability to understand emotions in other people, and which is probably why they lack empathy. They have frontal lobe, very often have frontal lobe dysfunction, which impairs executive functioning, decision making, that type of thing. This amygdala dysfunction, and the amygdala, very important in the fight-flight response, part of the limbic system, and it tends to lower anxiety and increase violence, the fight response. And also an under-aroused central nervous system creates people to be prone to boredom and seeking of stimulation. Criminal psychopathy is largely considered to be untreatable in clinical conventional type settings. There's even evidence to suggest that treatment may actually increase criminal behavior because they learn to better communicate with each other for the sake of conning each other. There is some evidence to suggest that large doses of psychosocial treatment may reduce the severity of future antisocial acts. It isn't necessarily going to eliminate future criminal behaviors. The identification of psychopathy is very important in ruling out treatment as usual, and ruling out parole. If you were a member of a parole board, you'd want to know if somebody is a psychopath, and you'd want to know how severe of a psychopath they are, because you'd be more likely to reject their parole. Psychopaths can con therapists and parole officers, probation officers, sometimes very easily, and they play the treatment game very well. Maybe the best treatment for a severe criminal psychopath is being in a non-stimulating, boring, where there's low social opportunities. Incarceration, again, may be the best treatment. Labeling juveniles as psychopathic is not beneficial and counterintuitive, but looking for psychopathic traits in juveniles can be very important, because early intervention may prevent future, if it doesn't prevent future psychopathy, it certainly can prevent future antisocial and criminal acts.